All right, everybody, welcome back to Paging America, where we explore the power, profit, and politics shaping American healthcare. I'm your host, Miles Baker, and this week we have a very special co-host, OBGYN activist, board chair of the Committee to Protect Healthcare, and now with her very own Substack, it's Dr. Kristen Lyerly, and we're glad to have her back. Dr. Lyerly, how are you doing today?
Hey, Miles. I'm so glad you think I'm very special.
Yeah. Okay.
I always love hanging out with you and talking about this stuff. And the agenda, the list of things that we have to talk about today. Oh my gosh.
Yeah, we're going to try to have we got a fun one today for everybody. If you're sticking around, we're going to have a little fun with it. We got, to get right into it, we got the Casey Means fallout. We have
Fallout.
Big developments in Texas, another week of RFK doing bizarre things. But Dr. Lyerly, before we get into the healthcare, we haven't talked since the Packers got knocked out of the
I thought you left that in accidentally. Really?
No, I'm sorry. I know it was like weeks and weeks and weeks ago, but we just haven't been on the podcast together, and we haven't had a chance to talk about how the Bears, who I'm not a fan of. I'm not a Bears fan, but I am recorded in Chicago. I did want to bring it up and see if you had any thoughts about how the season went for the Packers and what's coming.
The Packers are amazing. The Bears subsequently got beaten. Now they're moving to Indiana. What's the rest of the story?
Oh, brutal.
The team I own is still right down the street, baby.
Yeah, that's amazing. Amazing. Absolutely amazing. All right. Yeah. Great.
Sorry, it's in my heart. I'm wearing green. It's all I have, actually.
I'm not enough of a partisan on any of this stuff to even bring it up and have an interesting point of view. So.
But here's the thing about the Packers, not to make this about the Green Bay Packers, but we own this team, and it's such a small town that I think the people who live here not only love this team, win or lose, but we really like the win, but we recognize that it's important to the economy.
Yeah.
Very important. It's the anchor for the economy, and it's good for all of us. So everybody pitches in because it's so much more than a football game to us. It really is our livelihood.
That's great. Okay.
Yeah.
Well, for those of you who are missing Dr. Rob today, I think he's still out gallivanting somewhere in Oceania. But he'll be back in like 2 weeks. We are grateful that Dr. Lyerly is here to help explain some of the healthcare news and the big events of the week. So let's get right into it, Dr. Lyerly.
Let's go.
So Casey Means Surgeon General nomination might be in trouble. This is incredible.
I got the sense, though, I watched the hearing, and right from the very beginning, I just got this sense that they were skeptical about her. And I mean, let's be very honest. Objectively, she's unqualified. She never finished her residency training. She has never independently seen a patient. She does not hold an active medical license. Her job, her company sells continuous glucose monitors to people and supplements. It's not evidence-based. She is not qualified to be the public health officer for the United States of America, getting vaccines to kids who live in areas where they otherwise would not get health care, making sure people, there is just so much that goes into the public health sphere that she has no experience with. So right. I was super glad to see Cassidy with his skepticism. I thought he was going to be more welcoming, and right out of the gate, I felt like it was the hearing was very interesting to watch.
Yeah. So a little bit about the hearing. Several outlets are reporting that her chances of becoming Trump's pick as the nation's doctor were reporting that it was all but certain. But senators from both parties pressed Means on her views about vaccines at the hearing. Means did not commit to promoting them and now has to convince at least two skeptical Republicans to back her nomination. That's Susan Collins of Maine and Lisa Murkowski of Alaska, who told Politico they haven't decided how they'll vote. The Republican-controlled Senate has turned back very few of Trump's nominees, but one of the first was Trump's pick to lead the Centers for Disease Control and Prevention. The White House withdrew the nomination of former GOP Rep Dave Weldon last March after Murkowski and Collins raised concerns about his vaccine views, not particularly different from Casey Means' vaccine views, although she downplayed them in the hearing. You may recall that Collins was particularly concerned about Means' promotion of magic mushrooms during the hearing, which I got a kick out of.
Yeah.
She was just desperate desperate to find some critique from the right, and she landed on like a benign Schedule I narcotic.
Yeah. She was very concerned about it, but you could tell. And even when she was done with her questioning, she was like shaking her head like, no,
I don't like that answer. That's right. So Casey Means in trouble. My opinion on this, Dr. Lyerly, is like, we got to take W's wherever we can get them. Like, is the Surgeon General is an important job. Is it the most important job inside of HHS, at the CDC? Perhaps not. However, it's this super important public communications function. It also has like 6,000 staff that it leads of like actual scientists and doctors. And so to have someone who's either like, what would we call it? Like center right quack. Like a center right quackery.
She's an influencer.
Yeah.
She is not a practicing. She's never, she's never been a practicing physician. She is a wellness influencer. She is not qualified to do this job. So yeah, we need this W, but not just because it's a W. The American public needs her not to be the Surgeon General.
That's right. Just a little bit of plug for action. If you are fired up and do not want a wellness influencer being the nation's top doctor, in the show notes, you will see the Committee to Protect Healthcare's petition to stop her nomination. You can sign that if you're a doctor or nurse. Please go to the show notes and check that out. But we'll be following this. I think this could be a big loss for Robert Kennedy and therefore a big loss for the Trump administration. So we'll see what happens.
Yeah, I look forward to that.
Yeah,
keep pressing. Keep pressing.
Yeah, absolutely. All right. So we have huge news out of Texas. Everyone's been watching the Senate primaries, both on the Republican side and the Democratic side down in Texas. James Talrico has won the Democratic U.S. Senate primary. The Austin, Texas state representative beat out U.S. Representative Jasmine Crockett by nearly 7 points. Talrico will now face off against the winner of the May 26th Republican runoff election. Either incumbent John Cornyn or conservative supervillain Ken Paxton will be the nominee for the GOP. And it seems like after the votes migrate from the third candidate, it's going to really come down to a nail biter. This is from the New York Times. Serving in congressional leadership used to be considered an advantage back home and a badge of honor, but President Trump's hard-right base despises the political establishment, and to many of them, Mr. Cornyn's leadership record makes him a card-carrying member of the detested Uniparty, which they see as a Washington cabal of politicians. Paxton, on the other hand, has been the Texas Attorney General for over a decade, and as extreme as Republicans can get in the country, the accusations of crime, the using the government against your political opponents, the over masculine bravado in public, you name it, he checks all the boxes for the mega hardliners.
Didn't he give his employees a day off after Roe was overturned to celebrate? I mean, this guy is wicked. And you know, the cool thing about what's going to happen with this race between Cornyn and Paxton, they are going to spend so much money beating up on each other, and we can just sit in the bleachers and grab our popcorn and watch. It's going to be beautiful.
That's great. So the very first thing that I wanted to understand, and I think our listeners understand, if Talrico is the nominee, and if he's the nominee in Texas, he very well could be the majority making. That could be the majority making seat for those who aren't calculating Senate numbers all the time. Like Talrico could be the majority maker. That's why this race is so important, not just because historically Texas has been so Republican, but because the whole ballgame in the Senate could be on the line in Texas.
Let me reframe that. So that means that the entire U.S. Senate could flip blue based on this one seat.
Yeah, the entire U.S. Senate could come down to Texas, which is not
That's so crazy.
Not a situation I like. It's not a situation I'd pick.
I wasn't expecting this, but I like it.
Right. But so we grabbed some video of Talrico's position on healthcare. Let's play that now.
If you had to tell voters about one vote you've taken or one idea you've championed as they're voting in this primary, what would you tell them?
I'm a type 1 diabetic. When I was first diagnosed, my insulin cost me $684, and I worked across the aisle with Republicans to pass the first ever cap on insulin copays in state history, capping insulin at $25 per prescription. I beat Big Pharma by bringing Democrats and Republicans together to pass real reform, and that's the kind of action we need in the U.S. Senate.
How do you handle health care if elected, to the U.S. Senate?
Well, I think we need universal coverage. We need to make sure that we protect rural hospitals. We need to make sure that everyone can see a doctor when they need one. That's what I'll fight for as our next U.S. Senator.
So in the same way that Paxton checks all the boxes for the MAGA hardliners, Talrico, for those of us who are healthcare advocates, my two big boxes would be, is willing to use the government to take on big pharma and lower prices, check. Is interested in universal care, check. For some people listening, there will be a third box, which is Medicare for all or specific outlinings of public option. And I would just contend to everyone, with so much on the line in the Senate, do not make Talrico take a very specific position that could hurt him. I'd say let Talrico have the tactical flexibility. If he's values aligned on universal care, good enough for us right now in the Texas Senate race, and let him have the maneuverability to try to do everything he can to get to a W. I don't know. What's your take, Dr. Lyerly?
I don't get a sense that anybody is actually going to move him on his current policy because it's working for him. And he has a great backstory. When you look at his life and how he was raised, and there was a domestic violence situation. He's a type 1 diabetic. I mean, this is a guy who has so much foundation. And that is where all of this policy and where his perspectives come from. He is not, and he doesn't come off as political. He comes off as really sincere. So I think that the people of Texas find it appealing, and I think it gives him a really great advantage in this race.
It's so funny that you say that it comes across severe, Dr. Lyerly. I would just say with Talrico, like, I get a little "don't trust your life to no backwoods Southern lawyer." I get like a little bit of that energy from him, but I don't care.
Really?
I do. I don't care. I mean, like, I like Jasmine Crockett and I like James Talrico. Like, I like both candidates. I probably would have pulled the lever for Talrico, but it would have been a close call. And I don't care. I don't. I like if the religiosity makes people worried, I think just look right past it. like look right past it. This race is so important.
But he doesn't talk about it in terms, in like extremist terms.
Totally,
he talks about it in very like conventional terms. Like, this is what's important to me and other things are important to you. And I think that a lot of people can just look past that, but also people who tend to be more religious can see that and feel comfortable with it. So yeah, I mean, it was just looking at those two candidates, I was glad I didn't have to vote for one or the other, because they were both so good. And I look forward to seeing what Jasmine Crockett does in the future, because she is not going anywhere.
Yeah. See, hopefully I think she's probably headed to TV, if I had to guess, because because she could draw the eye, right? So
she's a firebrand.
Anyway, that's an exciting developments down in Texas. Hopefully we'll stay on top of that race. That's going to be one of the big races we're watching all year long. So we'll go from there. The weirdness, Dr. Lyerly, the weirdness out of RFK and HHS continues apace. It's been another.
As if it could get any weirder.
It's getting weirder. It's getting weirder. It is. It's been another week of RFK weirdness. So let's review. We're going to go through a couple of instances. First, during an appearance on Joe Rogan's podcast last week, he told Rogan, "I think I was born with ADHD, and back then they weren't diagnosing it, but I was bouncing off the walls. I did so poorly in school." This is, if we go back to some of his previous tape, this is what he said. He found heroin and it calmed him down so he could study. This is also one of his quotes, but
he's doing a lot of introspection publicly.
He's doing a lot of public introspection. He has the ability to go get diagnosed. Now, he's the head of HHS. He has access to a physician. He doesn't need to speculate. He could go talk to somebody.
No. Well, Casey is busy right now. Also, she doesn't have the ability to prescribe things. So
right, even if she can't diagnose him and then even write him a script. So
yeah. Also, she did an ENT surgery or an ENT residency, most of it. So it's not her wheelhouse.
Then Kennedy continues to let them eat steak. He continues to
what kind of steak though?
Yeah, so as long as it's cheap steak, during an event hosted by Maha Action, he said that people could eat liver and cheap cuts of steak to address affordability concerns of eating healthy. Most of the cheap cuts of meat are very inexpensive. If you buy, a porterhouse steak, it's going to take you back. Then you can buy liver or on the cheaper cuts of steak that are very, very affordable. So
Great idea. Who doesn't love cooking liver? Did your parents cook liver for you growing up?
I had this good friend, if he's listening, I had this good friend from college who would always get chicken livers for breakfast. And I always thought it was so gross.
My mom used to cook liver and it stunk because she grew up on a farm. So it smelled, the whole house was like liver is not an appealing food to eat.
No, it's a crazy thing to suggest eating liver as to address the affordability crisis. It's also true that the HHS secretary really going to bat over and over and over again, and with policy and with his words for red meat, is a funny make America healthy again. I'm not sure that makes America healthy. I like a burger from time to time. What are we doing pushing red meat to the extreme? That's industry capture from my perspective.
He put it at the top of his food, whatever the shape is now. I mean, red meat is front and center. It's not fruits and vegetables anymore. It is, the food triangle. It is right there. It's so clear, though, going back to that initiative, which was, I don't know, it feels like a million years ago, but it actually was just a couple months ago. If you look at the people who informed that initiative, it's not evidence-based. It's all people who worked for industry. And it's clearly, if you look at the notes, it's clearly all there. So this is biased. The whole pushing red meat is lobbying. He's lobbying the American public. I was thinking about in wartime how leaders would ask people to conserve. There were rations. You had to be careful back during World War II, and people were happy to pitch in. Now we've started a war and we're telling people to eat liver. What is happening right now?
Yeah. Yeah. Got it. I am hopeful that in whatever comes after the Trump era, so we get in the 1950s, we get the food pyramid that says you should eat 11 potatoes a day. Okay. And then,
it did not say that.
It did say that. It said 6 to 11 grains of potatoes. Yeah. The old food pyramid, we hate the new food pyramid because it's stupid because it's got saturated fats at the top, but the old food pyramid said have 11 potatoes. So let's get rid of the food pyramid. Let's have a new shape. Let's have a set of dietary guidelines that make some goddamn sense.
That are developed by dietitians and people who understand nutrition using evidence and data.
So it's just another instance of the Trump administration correctly identifying a problem, and then the solution is batshit.
It's like the Atkins diet. It just harkens back to the Atkins diet. Eat more bacon and red meat, and you'll be healthy.
Yeah, I did that. I think I did that once for 4 weeks. It hurt.
What were you in junior high?
Physically painful. No, I think it was a little after college. I was trying to drop 5, and I was like, this sucks. I want some rice.
Yeah.
Okay.
I like having regular bowel movements. I don't know. That's important.
All right, Dr. Lyerly. I have we're still in the category of RFK weirdness. I have a video. I don't think you've seen it yet, so I'm looking for your real-time reaction, but could we roll the tape?
Introducing the Secretary Kennedy action figure. With chronic disease running rampant, President Trump is sending one man.
Robert F. Kennedy Jr.
Watch out. Red 40 is in your kid's lunch. Quick, increase your strength with real whole milk.
Wow, it's full of protein and healthy fats.
And ban Red 40 to the trash.
Take that.
Oh no, a peregrine falcon is stuck in the river. Quick, swap into your denim jeans and jump in.
Wow, waterproof jeans.
Oh no, the food pyramid puts Fruit Loops at the top.
My message is clear: eat real food.
Flip the pyramid to put the real food we need on top. Bring home the full Maha playset today with limited edition Iron Mike Tyson.
Eat real food or else.
Accessories sold separately, batteries not included. Get active and eat real food.
Wait, I have questions.
Yeah. That's from HHS. That's from the government.
They really put that out?
Yeah, that's a government video. Yes.
And they made it it's like that. And banged his head into the pyramid like that?
Yeah, they did.
Wow.
Real. Yeah. You're speechless. Jeans. You don't even, I was looking for a reaction. It's speechlessness. Yeah, waterproof jeans.
And Iron Mike Tyson.
Yeah, right.
Okay.
Yeah, I don't know. Your taxpayer dollars paid for that, everybody. I I agree. Fruit Loops were at the bottom of the pyramid, and it said to have 6 to 11 grains or potatoes, and so it wasn't exactly Fruit Loops, but
so it's all in the nuance, right? Because we have FDA regulations that say that they can put whole grains on things like, and maybe it's on Fruit Loops, but it's definitely on some cereals that are not healthy for you. So this is an opportunity for him to be serious and regulate things that are unregulated and unhealthy instead of mocking it and making it a parody and distracting people so that they can profit off of it. The American people are... How is it possible that we have these people in leadership who are so irresponsible?
I think it's a funny choice. Well, it's a two-part funny. I think it's a two-part funny choice. The first funny choice is to have jeans in water be part of your brand. Like, you got mocked on the internet. You're going to actually say, like, no, I wear my jeans all the time. I'm going to have it be part of my brand. That's funny choice one. Two, that you are so committed to that funny choice that you will use the United States Treasury to promote that brand. And you are going to release things from HHS, and you are going to make advertisements that show you underwater in your jeans. So they use the attention economy. We're here talking about it. They use the attention economy so well, but that one is just too much for me. I had to get your reaction.
Yeah, jeans take a long time to dry too once they've been submerged. So as a mom who washes jeans, that was my first thought. But it's so irresponsible, and they just keep doubling down on these messages.
Yeah.
I mean, I haven't seen really any examples of them stepping back and saying, we were wrong, or let's take a different path. And I think that's the most concerning thing, is that it keeps getting worse and worse. But that's also maybe going to be the redeeming thing, that the more they double down, the more they're going to lose people. And the more they lose people, the more we can pick them up and help bring them back into the fold so that we can all start doing the healthier things together.
Yeah. And maybe just to talk about the politics of it for a second, you can see with stuff, publications like this or weird little internet videos like this, they're leaning into the nutrition, even if the nutrition's a little wrong. They're leaning into the nutrition and the food communications, and they're leaning into the dyes and like getting dyes out of food. You saw that weird little monster attacking that kid. So strange. But they're leaning away from vaccines, and I think the Casey Means not having the votes in the Senate hearing is part of that. But you're also getting like their pollster Tony Fabrizio recommending that they don't talk about vaccines anymore because they're starting to get data back, political data, not health data, that shows that it's just a stone cold loser for them. There's state by state polling and national polling that says people are just grossed out by it. They don't believe it. Is it having a deleterious effect in vaccine uptake? Yeah, because some people are believing it, but the vast majority of people are like, that's way too far. He said he was going to go there. We didn't believe him, and then he exactly went there, and now they're having to walk it back.
Yeah, you're exactly right. And KFF has this data, and the data shows that a lot of these decisions, a lot of these opinions, not surprisingly, are partisans. So even with Democrats, they're losing confidence in vaccines, but Republicans absolutely are.
Right.
So the messaging is really important here. And medical community, we got to continue to stick together and talk to our patients and make sure that they've got the information that they need, because they're not getting it from the sources where we used to be able to rely on.
Yeah, absolutely. All right. In news that is a little bit more serious than HHS, goofy videos from HHS. So deductibles for ACA plans this is reporting from the New York Times, deductibles for ACA plans could be as high as $31,000 for families coming up because of the loss of subsidies and all of the attacks on the marketplace. From the New York Times reports, the Trump administration proposed new rules for Obamacare plans next year that would shift more health costs to Americans with much higher deductibles that could lead to larger medical bills. Dr. Oz's new proposal would allow one kind of health plan to raise the annual deductible to more than $15,000 for an individual and $31,000 for a family. The individual deductible would be 8 times the average for someone with job-based insurance.
People don't have it.
No one has that. No one has that money.
People don't have it now. They can't afford their health care now. We know that we've got data that shows that a lot of pregnant people are skipping care and not entering care until the second trimester because they just can't afford it. And now it's going to get worse.
This is from the Orange County Register. Cal Optima, Orange County's health insurance program for the poor, has seen a plunge in membership since summer, which advocates attribute to the effects of the Trump administration's hardline immigration policies and sweeping changes to Medi-Cal. More than 26,500 Cal Optima members have left since the start of the year, dropping the total enrollment to roughly 822,000 in mid-February. According to data shared from the agency, some 15,000 people dropped from their health plan just in February. And so we've been talking about this all year, but you're starting to see the cumulative effects of the congressional attack on Obamacare and Medicaid, the attacks on subsidies for Obamacare, and now this new administrative tinkering where they're not using legislation, but they're using administrative maneuvering to go after Obamacare plans and make essentially this component part of the social safety net unappealing to consumers as a way to undermine it on top of all that they've done before. It's really a full, it's like they tried to get rid of Obamacare in famously when Trump was first elected, and they got the thumbs down from John McCain. And now they're doing like death by 1,000 big cuts.
Mm-hmm. And it's all those direct things that people can see and feel, but the indirect impact is going to be the thing that strangles the American public. Because what's going to happen when people say, I can't afford my premium anymore, or there's a $15,000 deductible, there's no way that I'm going to be able to pay that. They're going to drop their insurance. And then when they get sick, and some of them will get sick or they'll have accidents, things will happen, they'll go to the emergency department.
Yeah.
And they won't be able to pay. And the hospital will have to eat that. And if they are at a hospital that already is running, I mean, almost 10% of hospitals are barely making payroll right now.
Yeah.
Hospitals don't have any margins to give at this point either. So more hospitals will be closing down, shutting down services, essential services like obstetrical care. And it is just this vicious circle of people losing access to healthcare, whether it is directly by dropping their insurance, their ACA insurance, or losing their providers in the town where they live.
And Dr. Lyerly, so J.D. Vance claimed that rural hospitals were closing were Joe Biden's fault. I think he did that in Wisconsin. Is that right?
He did it in Western Wisconsin. He's claimed a lot of things.
Yeah. And so there's two hospitals in Western Wisconsin. There's one I believe, in Eau Claire, and then something closer to La Crosse that have closed. And those
there are so many. They've closed all over the state, especially the obstetrical units. We've lost over half of our obstetrical units in the last 20 years here in Wisconsin.
No kidding. Yeah, okay. Yeah. So that doesn't sound like, it sounds like there's like a long-term problem, and then there's sort of a short-term, this new issue with so many people dropping out of the marketplace that you're looking at like the financial viability of clinics and hospitals becoming more precarious. And so you have sort of these dual challenges of the hollowing out of rural hospitals over time, and then this acute crisis of so many people dropping off the rolls and having ERs have to essentially cover what would have been covered by Medicaid previously.
That's exactly right. And it's so easy for him to draw a line and say your hospital closed because of Joe Biden, because it happened when Joe Biden was the president.
Yeah.
But it is the cumulative effect of our failing healthcare system.
That's right.
The ACA, far from perfect, but a step in the right direction. Now we are running in the wrong direction by cutting Medicaid, by cutting ACA subsidies, by driving trainees out of states that have abortion restrictions. That's some other new data that came out recently. People of all specialties are not wanting to train in states where they could go to jail for providing standard medical care. Not just people who provide reproductive health care, but pediatricians. I mean, everybody. So it's like you said, death by 1,000 cuts, and we've got to make that apparent to the American people, especially in November, Miles.
Yeah, absolutely. I just to revisit that, the loss of OBs in places, I was reading how like Idaho is now going to be pretty close to a obstetrics desert. And
they've lost more than a third of their obstetrician gynecologists, and they're all concentrated in an urban area, and they have, I don't think, any high risk OBs anymore.
Right. You almost have to leave Idaho for high risk.
Yeah.
That's so, it's so crazy how the policies they're pursuing for their internal politics inside the GOP, the real world consequences is like just giant swaths of their people not being able to access basic healthcare, the basic healthcare of a developed nation.
Yes, but they don't draw that direct line.
I know
it's
they don't,
because it takes too long to get to the consequence that people don't put it together.
Right.
But we can help as messengers, as people who are having these conversations. We can help, and it's not political. If you are somebody who is not comfortable having political conversations, just draw the line. Help them understand this is because of government funding being shut down.
Yeah.
What can I do about it? You can vote for people who vote for government funding. You don't have to make it about Democrats and Republicans. Just invite the conversation always, because everything is political.
Yeah. Dr. Lyerly, in the month of March, very far away from November, fired up for folks to vote. You heard it here first. You fired up for folks to vote. Me too.
I am,
me too.
because we have an incredible, in Wisconsin, we have a very important Supreme Court race. Yes, in just a month. So we are, it's Wisconsin. We're purple. We're always thinking about how can we pull people over and help them understand what's at stake. So yeah, of course I'm fired up. Chris Taylor, amazing.
This is probably a good segue. So we have a interview with Judge Chris Taylor coming up next, and so why don't we throw to that now, and we can go hear what Judge Taylor has to say about her race, her incredibly important race for Wisconsin Supreme Court. Okay, welcome back, everybody. Today we are pleased to be joined by Judge Chris Taylor. She has 30-plus years legal career serving as an attorney, legislator, and judge following her appointment to the Dane County Circuit Court in 2020. In 2023, she was elected to the Wisconsin Court of Appeals, and she is running for the Wisconsin Supreme Court, and we are so pleased to have her. Judge Taylor, thank you so much for joining us at Paging America.
Thank you so much. It's such a pleasure to be with you this morning.
So you guys know each other, having done a recent show together, but I haven't had the pleasure of meeting Judge Taylor before, so this is a treat for us. Judge Taylor, how do you all know each other? Actually, before we get started,
we go way back when Judge Taylor was involved in Planned Parenthood here in Wisconsin decades ago. And I was a medical student just getting my feet wet in reproductive rights advocacy.
Great.
Yeah. That was decades ago now.
I know.
I worked for Planned Parenthood of 15 years. So yeah, that was a long time ago.
And then we just keep intersecting because you served in the assembly and you've been such a champion for women and the underserved and vulnerable populations. It's just been a through line for you, the justice piece. I love that your website is Chris for Justice, because justice is your core.
It is. And it has been since I was a little kid. That is always what I craved. I wanted people to be treated fairly. I wanted people to be respected and have an opportunity to have their voices heard. And that is the through line in my entire career. It's why I went to law school. And it's why I did the work that I did after law school. I am absolutely passionate about making sure people are at the center of our government and our democracy, and their rights and freedoms are protected. And it's never been more important, actually, as we see an erosion, quite frankly, of our fundamental rights and freedoms, and particularly on reproductive health care and access to reproductive health care, which is really concerning.
Yeah. Absolutely. Judge Taylor, so maybe if I could just jump into a couple of questions for our audience to get to know you. So if we get you mentioned this was a while ago now, but you served as the legal and policy director for Planned Parenthood, Wisconsin, where you worked to successfully pass the Compassionate Care for Rape Victims Act through a Republican-controlled legislature.
Yes.
The bill required hospitals to inform sexual assault victims about emergency contraception. You've also championed protections that guaranteed access to birth control. It sounds like at different points in your career, you've had to work with people from different viewpoints and inside of a Republican legislature. What was that like? What were some lessons learned from that? And is, now when we have this moment of political tumult and it seems like the division between the two parties is wider than ever.
Yeah, no, it was a great experience, honestly, because I worked across the aisle on these issues that should be nonpartisan. Honestly, whether women have coverage in their insurance plans for prescription contraception, which did not happen in a lot of instances, whether women could get at the time birth control dispensed at a pharmacy counter. We were having incidents of women going to pharmacies and being told, no, we don't approve of this and we're not going to dispense it. And so we also passed the Prescription Protection Act. And then this compassionate care for rape victims, which was really alarming. We were hearing from survivors that they would go to the emergency room after tragically being assaulted and they'd get STD treatment, but no one would ask them about pregnancy prevention. And no one would tell them that there was a way to prevent pregnancy prevention through emergency contraception. And so that's what I worked on. And I loved working with different people who had different viewpoints. The big sponsor of that bill was a Republican representative, Terry Musser, and he was from Shawano, I believe. So this, pretty rural town, but he came to the hearing and he listened to the women tell their stories and he was moved by it. And he championed that bill and he has passed. But I had such an incredible time working with him and it really taught me, keep your ears open. Let's not stop talking to each other. Even when it seems like we don't have anything in common, we do have more in common than we don't. And I continue to really believe that. And so it's important that we continue to talk to people about why these issues are so important and so necessary for women and families to lead their dreams and live their lives.
Absolutely. A quick follow-up on that. So you've championed protections for birth control. What do you make of some of the state legislative attacks that we've seen, less in the state of Wisconsin, but in different places across the country where people are they're going sort of beyond reproductive care and abortion care and onto birth control. And you haven't seen a lot of movement where that's become law, but you've started to see it bubbling up, particularly in the American South. Are we worried that this is the next frontier of attacks for the sort of far right or the religious right? And can the courts be a bulwark against that?
Well, we've seen this now for a couple decades, believe it or not. I mean, when I was at Planned Parenthood and then in the legislature, we did see efforts to restrict access to birth control. They are in the form of maybe not covering birth control and whatnot, but that's not a new thing. In fact, I have to say, the person I'm running against for this seat in her last election was endorsed by a group that does not support hormonal contraception. They do not support birth control. They do not support fertility treatments. And they don't support abortion in any instance, even when a woman could die. And so that kind of extremism has been around for a while. I think it's important that policymakers be aware of it. Of course, I'm not a policymaker anymore. I'm a judge. But these issues have not gone away. We continue here in Wisconsin to be at risk that the legislature can pass more restrictions on reproductive health care. We have a big midterm coming up. Depends on who's in the legislature and who's our governor. But we should be very wary and watch this very closely. This is still an issue here in the state of Wisconsin and throughout the country.
Absolutely.
And you brought up that there are a lot of seats up in November. I mean, the governor's seat is up. The entire legislature is up. This is Wisconsin, so we just don't know which way it's going to go. And your election is in April. In the past couple of years, we've had some pretty spicy Supreme Court elections here in Wisconsin. I do have a fond memory of Elon Musk standing with a cheesehead, handing out those big Publishers Clearinghouse checks. Yes, but Susan Crawford won that race because the people of Wisconsin understood what was at stake here. Your race is different. It's not as high profile. It's not as expensive, but it's still important. Tell us why.
Well, look, we have now a pro-democracy majority on this court, 4-3, but we have 5 elections coming up.
Yeah.
We have 4 after my election. And that should, I hope, cause people to take notice. It has never been more important in my lifetime that we have a strong court to protect our rights, to protect our democracy. We have seen people come after our elections here in Wisconsin. We had numerous lawsuits after the 2020 election of individuals trying to overturn our election and throw out 3 million votes. in the state of Wisconsin. Those efforts were rejected by only one vote. That's it. And so the court continues to be so important. And on that note, too, I just want to contrast my opponent's background as well. She was supported in her last judicial race in 2022 by the individuals who led the charge in trying to overturn our election. She issued a decision not long ago that would have turned over private voting information to the same people who tried to overturn our election. Now, thankfully, that decision was overturned. But I am running against someone who is not going to protect our rights. She said overturning Roe versus Wade was very wise. She has stated she would have likely voted to enforce an 1849, I'm going to say that again, 1849 abortion ban. And she suggested that she would be okay with a 6-week abortion ban here in Wisconsin. So this person's not going to protect our fundamental rights and freedoms. She's not going to protect our elections, our right to vote, and any of these things that are being eroded.
Mm-hmm. And for our listeners, I know a lot of people who've listened to this, they've either been knowledgeable about or participated in the ballot initiatives across the country that have protected reproductive rights or put abortion access in their state constitutions. That's not available in Wisconsin. There is no ballot mechanism that can amend the Constitution, so that the judiciary becomes all the more important for that. So just flagging that.
Absolutely.
Yeah.
The one thing that can be done in Wisconsin, but it's very difficult, is you can, if a constitutional amendment is passed 2 times in 2 successive legislative sessions, it can go on the ballot. But given the composition of the legislature, that has not happened on reproductive health care. Could it happen? Maybe. It's probably a real long shot.
Sure.
But we don't have anything that says the right to make these personal private decisions are protected in our Constitution. Our 1849 law was struck down on a different statutory theory. And so when my opponent goes out and says, well, it's settled law, not so settled. That's also what Brett Kavanaugh said during his confirmation hearings to the U.S. Supreme Court. And the minute he got a chance, what did he do? Reverse Roe versus Wade.
Exactly. Yeah.
Yeah. And the power is not in the hands of the people. The power is in the hands of the legislature.
Politicians.
Yes.
Politicians will decide if a woman who tragically has a pregnancy goes wrong, a wanted pregnancy. This happens all the time, whether her health and life are going to be saved, whether she's going to get the medical care she needs. And I just don't think that is correct. I value each individual's right to make their own personal private health care decisions.
Can I ask, we've talked about reproductive rights. We've talked a little bit about voting. What are the other big issues that you see on the horizon that will affect not just our health care, but our ability to live, all those social determinants that affect our health in general?
Yeah, no, there could be so many things. I'll tell you, probably the thing that I'm looking at is the overreach we're seeing from the federal government. The federal government attempted to shut down food share, which has a huge impact on low-income families. That was a court that stopped that. And now we're hearing things like, well, the federal government wants to take over our elections, which is specifically a state issue. That could have incredible ramifications for people's ability to vote and actually pick their elected representatives. There's so many things going on right now in the healthcare sphere at the federal government, whether it be vaccine issues or, as we're talking about, reproductive health or just access to affordable health care. Are people going to be able, we already seen that healthcare premiums for a lot of families are going to go up with the ending of the subsidies through the Affordable Care Act. So I suspect we could see some issues that are impacting access to healthcare in other realms. It's always hard to tell, but I certainly do think the issue of reproductive healthcare, specifically in the issue of democracy, voting, and our rights as a state are going to be on the table.
Yeah. It was heartening to see that Wisconsin was part of the cohort of states that refused to send the Justice Department their unredacted voter file.
And we're being sued now because of it.
Yeah. Yep.
So
Absolutely.
the federal government is now suing the state of Wisconsin to get all of our private personal voting information, our driver's license numbers, pieces of our Social Security. Well, why do they want that?
It's a good question.
Why do they want that unless they're building maybe their own voter file?
That's right.
So we have resisted that. There is litigation going on currently in the federal courts. And this is going to be a real issue going forward with us trying to protect our state and our people here in Wisconsin from this massive overreach.
It just underscores the importance of the courts and our ability to fight through the legal system, because our legislators, all the checks and balances are not working. So we need our courts to be strong.
Yeah, absolutely. Right. In fact, the courts really have been, in some ways, the last line of defense from some of the really alarming things we're seeing throughout the country, whether it be people who are trying to exercise their First Amendment rights to peacefully protest, having violence used against them. So all of these things are things I never thought I would see in America, honestly. And we have to make certain our courts are strong and ready to defend us.
Maybe to wrap up, Judge Taylor, we could talk about the state of the race. So this is a race that is, it shows you with a 5-point lead recently, but with almost 2/3 of voters that are undecided. I suspect that's because some of the major advertising is just beginning or hasn't started yet, and so you'll see that undecided number close pretty rapidly over the course of the next few weeks. But if people who understand the importance of this race want to get involved and they want to help persuade their neighbor, where can they go for resources? Who can they reach out to? How can they help?
Excellent. Well, thank you for asking. They can go to my website, Chris, CHRIS4FOR, justice.com. There's an opportunity to volunteer. There's an opportunity to join the campaign. So you're getting updates about what we're up to. But, everyone has a role, and there's something everyone can do, whether it's writing postcards, wherever you are, making phone calls. Of course, if you're here, we love the grassroots, the direct action democracy of knocking on people's doors. It's so effective to do that. And if you're in Wisconsin, it would be really helpful to have people start talking to their friends, family, and neighbors. This election's coming up in 33 days. And, I don't know what is coming at me, the tsunami of extreme right-wing billionaire money. But I suspect it is coming. It's never not come. And so, I have support. My campaign has received so much support from the people of the state of Wisconsin and people out of state, too, who care about these issues and care about democracy. So we need all the support that we can get. And we welcome anyone who cares about these issues: democracy, justice, rights, making sure that our courts are strong, making sure the other branches of government are held in check, to please join the campaign, get involved. There's lots to do. We have a lot of work to do. As you mentioned, Miles, 2/3 of voters are still making up their minds. So this is in play, this race. And we will not take our foot off the gas until April 8th. So everyone remember to vote April 7th. Early voting starts 2 weeks before. And if you haven't requested your absentee ballot, if that's something you do it now, because those are going to go out really soon.
All right, everyone. I'm going to repeat that website. If you want to help, if you want to get involved, if you want to make a donation, go to chrisforjustice.com. And this one's an important one, so stay tuned. Judge Chris Taylor, thank you so much for joining us today. I paid you to America.
I so appreciate it.
Thank you, friend.
All right, and we're back. That was a great conversation with Judge Taylor.
She's outstanding. She's so uniquely qualified, having served in the private sector, in the assembly, as a judge. She sees things from so many different perspectives. I'm incredibly excited to have her on our court.
Yeah. And so if you are listening in Wisconsin, please get out there and volunteer for Judge Taylor. I know we said this before. We're going to say it again. Please get out there and volunteer for Judge Taylor. And if you don't live in Wisconsin and you want to hop on the website and make a little donation, you should do that.
ChrisForJustice.com.
Great. All right, Dr. Lyerly, before we wrap for the day, anything else you want to share with the Page in America audience?
No.
You have a new Substack. Where can folks find your Substack if they want to listen?
Yeah, I do. Oh my gosh. And I just talked with Annie Andrews yesterday about Lindsey Graham, who, we're not talking about war today, but Lindsey Graham's always talking about war. He's the guy who finally found somebody who would bomb Iran. Yeah. So Annie Andrews is a pediatrician who is running against Lindsey Graham in South Carolina, and she's amazing. She's doing the work, but she needs all of our help. So she's just one of many guests on the Dr. Kristen Lyerly Show that you can find on Substack at Dr. Kristen Lyerly.
That's great. Yeah. Well, Dr. Lyerly, thanks so much for filling in for Rob. I'd say it's 20% more pleasant when we're chatting. No, just kidding. We'll see if Rob listens.
50%.
50% more pleasant. No, but I really appreciate you taking the time. I think I'm going to read us out and I'll call it a day. So today's episode was written by Chris Savage, Dr. Kristen Lyerly, and me, Miles Baker. It was produced by Amelia Dillenschneider, Joel Bryson, and Chris Savage. It was edited by Darian Badigan. Our music is by Annette Somerset at Duneflower Productions. And if you enjoyed today's show, please subscribe or leave us a rating on YouTube, Spotify, Apple Podcasts, or wherever you listen. Your support helps others discover the podcast. You can also follow us, Page in America, on Substack. And if you would like to become a paying subscriber, it helps us do the work that we're doing. And physicians, your voice matters. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. Visit www.committeetoprotect.org. Dr. Lyerly, as always, what a pleasure. I hope you have a great day.
I love hanging out with you, Miles.
Bye, everyone.
Bye.